Good evening, class. In today's lesson, we're going to keep practicing about medical practitioners. Now, here we have hospital staff. In the United States, aspiring doctors should come to terms with the amount of studying and training required to become a licensed physician before they make the decision on whether medicine is right for them or not. So as you know, pursuing a medical degree is a really serious commitment, and that should not be taken lightly. So there, at least in the United States, the medical school typically lasts 4 years, but once someone receives either an MD or medical doctor or a DO degree. A DO means Doctor of Osteopathic Medicine, which is slightly different between medical doctor, because medical doctors generally focus on treating people with medication. I mean, treating specific conditions with medication. And DOs, on the other hand, they tend to focus on whole body healing with or without traditional medication. They generally have a stronger holistic approach and have been trained with additional hours of hands-off techniques. So now, after they had this degree, MD or DO, they generally go into the next phase of their medical training, typically a residency in their desired specialty, like surgery, radiology, cardiology, and so on. Now, aspiring subspecialists who wants to focus on a particular niche of a medical specialty, such as someone who wants to develop expertise in training on a specific type of cancer, as opposed to becoming a generalist oncologist who treats multiple kinds of cancer, they will ordinarily complete a fellowship in addition to a residency program. So as you may have noticed, medicine is a long-term study career. That means that for a medical student who subsequently completes a residency and fellowship, it made up to a combined decade or longer of training to become a physician. But what happens with medical school in the United Kingdom, for example? The people who work in a type of workplace, including hospitals, are called staff, as you know. So the medical staff in a British hospital belong to one of 4 main groups. First, we have a pre-registration house officer, OPRHO, or house officer, which is a newly graduated doctor in the first year of postgraduate training. So after a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation programming on the United Kingdom, the name of these junior doctors is Foundation Year 1 Doctor, or FY1. Then we have a senior house officer, which is a doctor in its second year of postgraduate training, and the title is now Foundation Year 2. After that, we have a specialist register, which is a doctor who has completed the foundation programming and is training in one of the medical specialties. There are also some non-training registered doctors who have completed their training but do not wish to specialize yet. And lastly, we have a consultant, which is a fully qualified specialist. There may also be some associate specialists, seniors, doctors, who do not wish to become consultants. In addition, there is at least one medical or clinical doctor who is responsible for all of the medical stuff. So now, to sum up, we have for US medical school, we have an MD or DO degree, then the residency, then subspecialists. For the UK, on the other hand, we have an MD doctors, then a house officer or PRHO, then we have the senior house officer, and then specialist register, and finally a consultant. So now let's talk about medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. So each consultant has a team of junior doctors to help care for those patients, and in many hospitals there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other allied health professionals. So now, when patients enter or are admitted to a hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctor takes their medical history and examines them. Sometime later, the register also sees the patient and may order tests such as X-rays or an ECG and make a provisional diagnosis. Then they begin the treatment. The consultant usually sees the new admissions or people who have recently been admitted to the ward for the first time on one of the regular ward rounds, when the management of the patient is discussed with the register. Consultants also decide when a patient is ready to be discharged or sent home. And on the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care. So now let's talk about the vocabulary for this part of the lesson. What is a multidisciplinary team? Well, a multidisciplinary team is a group of healthcare workers who are members of different disciplines, each one providing specific services to the patient. Next, we have be admitted to, and to be admitted is when someone allows you to enter to a place, in this case to the hospital. So now, what is ward? This is a separate room in a hospital, and typically one allocated to a particular type of patient. So what does this mean? For example, we have a children's ward, which corresponds to pediatric services. Next, we have X-rays, which you all know what X-rays are, and also ECG, which is an electrocardiogram. Next, we have diagnosis, which is the identification of an illness based on the symptoms. Next, for admissions, we have that admissions where admission is the process or the fact of entering or being allowed to enter to a place. And lastly, we have discharge, which I said before, it is when a patient is sent home, which means to be released. And now let's talk about shifts. First of all, we have to define shifts. Shift work is a kind of work that takes place on a schedule outside the traditional one. It can involve evening or night shifts, early morning shifts, and rotating shifts. So that means that in this case, junior doctors normally work in this kind of shifts, which means they work for 8 hours a day in the best of the cases. For example, from 7 a.m. to 3 p.m. and then they are free until 7 a.m. the next day. After a week, they change to a different kind of shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns or to be on call. Being available to return to the hospital if necessary from 5 p.m. to 9 a.m. the next day. For days on call, those are set out in a list of names and times. So what does to be on call mean? This is when a doctor is able to be contacted if it's necessary. Like I said, they are available to return to the hospital if it's necessary. So now that we have finished this part of the lesson, we're going to practice with some exercises. Here you have 2 boxes in which you have to make word combinations using a word from each box, like we did in a previous exercise, I think. You'll be given time to think and write down the answers. You can start now. Time's up now, so we have to check your answers. Here you have the word combinations. First we have associate specialist, then house officer, then we have on call, and we have provisional diagnosis and radio pager, and at the end we have word round. Let's move on to the next exercise. As in previous exercises, here you have to match the descriptions with the job titles. I'll give you some time so you can start now. Now time's up. Let's check your answers. Number 1. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. So, Dr. Graham is a consultant. Number 2. Dr. Stewart has just started the second year of her foundation programming. So, Dr. Stewart is a SHO. Number 3. Dr. Sinch has started his training as a surgeon. So that means that is a specialist register. Number 4. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. So Dr. Phillips is a PRHO or house officer. And number 5, Dr. Miller is in charge of the medical staff in the Brigham Hospital. That means that Dr. Miller is a medical director. In this exercise, we have 5 statements, and you have to tell if they are true or false and find reasons for your answers based on what you learned before. So let's begin. Time's up now, so let's check your answers. So for number 1 we have a medical graduate becomes registered 2 years after graduation. This is false because after a year he or she becomes a registered medical practitioner. For number 2, the system of training doctors in Britain is called the Foundation Programme, which is true. And number 3 we have the name senior house officer is no longer used in Britain. This is false because, as I told you, the old term senior officer or senior house officer are still in use. Number 4, the consultant is usually the first doctor to see new patients. This is false because they are usually seen first by one of the junior doctors. Number 5, when working in shifts, all doctors take turns to be on call. This is false because junior doctors now normally work in shifts. For example, as I told you, 7 a.m. to 3 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call. Now, in this exercise, you have to complete the text of a PRHO describing her job. Use the words you have learned before to complete this exercise. I'll give you some time to complete this and you can start now. Time's up. Now let's take a look at the answers so you can check if you did it right. I'll read the full paragraph so you can check your answers. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her ward round, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up request forms for blood tests and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the training foundation programming on Monday and Wednesday. Continuing with this class, we're going to talk about nurses. So, nurses working in a hospital have the following grades. We have a student nurse, which is a nurse who is still in training. We have also staff nurse, which is a nurse who has completed the training course. We also have a charge nurse, who is a more experienced nurse who is in charge of or responsible for a ward or department. And lastly, we have our nurse manager, who is in charge of several wards. We also have support workers. The clinical support worker who has done a short course and obtained basic qualifications. And we also have nursing auxiliary, who is usually not qualified as nurse, but both assist nursing staff. There are also ward clerks whose duties include making sure patients' notes and information are up to date, and they are also in charge of answering calls. So now let's talk about the verb perform and carry out. Both are used with all types of procedures, and they are often used in the passive form. As you can see in these examples, we have to perform an examination, an operation, a procedure, an experiment, a test, a biopsy. And we also can say carry out a biopsy, carry out a test, and so on. So what does perform and carry out means? It means to accomplish or to do or make an action, a task or a function. So here we have an example, which is the procedure was performed or carried out by a nurse. So now we can move on to some exercises for you to practice what we learned. Here you have some sentences which you have to complete based on what we learned before. You have 4 to 5 minutes to complete this exercise, so you can start. Time's up. Now let's check your answers. So now for number 1 we have someone who is qualified to assist nurses is a clinical support worker. Number 2, someone who is not qualified but is able to assist nurses is a nursing auxiliary. Number 3, a nurse who has qualified is a staff nurse. Number 4, a nurse who specializes in health promotion is a health visitor. Number 5, a nurse who looks after a ward is a charge nurse. Number 6, a nurse who works in the community is a district nurse. Number 7, someone who answers the ward telephone is a ward clerk. In this exercise, you have to make word combinations using a word or phrase from each box. You can start now. Time's up. Let's check your answers. For this exercise, the correct answers were: first, carry out a procedure. Number 2, change a dressing. Number 3, check the temperature. Number 4, give an injection. Number 5, remove sutures. In this exercise, you have to complete the sentences with the correct grammatical form of perform. You have 5 minutes. Time's up. Let's check your answers. Number 1. An isotope brain scan is painless and easy to perform. Number 2. Biopsy of the pancreas was performed last March. Number 3. If the patient's condition deteriorates, a laparotomy should be performed. Number 4. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Number 5. Last year we performed a randomized double-blind group study. For our last exercise, we have to complete the sentences with the correct grammatical form of carry out. You can start now. You have 5 minutes. Time's up. Now let's check your answers. Number 1. I now intend to carry out a larger study. Number 2. Unfortunately, few properly controlled trials have been carried out so far. Number 3. A number of studies have been carried out recently to look at this question. Number 4. A right hemicolectomy was carried out and the patient made a full recovery. Number 5. This procedure can be carried out in emergency department. So we have finished today's lesson. Thank you for joining this class. I hope you have a great evening and see you tomorrow.